about if you choose to or not. I don't know which it is, but I know that's why you're here in Washington. We sure appreciate the time in. Let me ask if there are any questions from folks in the audience for our guests and otherwise.
Nancy, how many communities across the country are actively engaged in this effort, and how much does the dwindling funds impact upon making a city more accessible?
Thanks. See, we got the turn the mic back on. Yeah. Thanks, John. Well, personally, I think every community ought to be engaged in this now that they've completed their initial requirements under the ADA to do a self-evaluation. A lot of those plans have been shelved, and so nobody is taking a look at it until all of a sudden they have a reason to go out and take another look at their community and say, how have we done when we compare where we are today versus that ADA requirement that we initially did under Title II. There have been more than, oh goodness sakes, I'm trying to think how many, over 100, well over 100, well over 200 communities that have entered the Accessible America competition. And we only have a very small handful of winners. We have 7 winners. So we know that funds are a huge issue. Some communities throw money at problems, and others engage their human resources to make a difference. You don't have to have money. We try to level the playing field so that small communities, like Florida, can compete against a large community like Houston, Texas, what, the 5th largest in the country, Houston? 3rd? 4th? They're big. They're big. We try to level the playing field because it's not just about money, it's about heart, it's about direction. We know that all those communities are not going to be perfect, but it's who has the vision, who has the heart, who cares about the people to begin to say, we need to make changes, and maybe we don't have the money to do it today, but we can sure lay the groundwork and the plans and start moving in that direction.
I just have a follow-up. How much does the emergency preparedness programs that each city has to have impact upon making this?
Sure, that's one of the reasons that we began to include emergency preparedness, because after 9/11 we found out that people with disabilities were pretty much overlooked in terms of emergency preparedness. And it wasn't just the professional community that was doing it, it was people with disabilities themselves. We had the heart-wrenching call from a woman who was in a power wheelchair when Hurricane Katrina hit. She called us from Louisiana and said, my transportation is no longer operating, and I thought I could get out and I can't. Can't you help me? We're in Washington, D.C., and there was nothing we could do, and sadly that woman drowned. That shouldn't happen to anybody. And we created this emergency preparedness initiative just so that people on both sides of the emergency preparedness response, before, during, and after an emergency, would have some ideas and some say in how those plans were going to go, and that people with disabilities didn't put others at risk, put their lives at risk by not evacuating. When they say evacuate, evacuate. Get out of town and not expect that emergency responders who have to stay behind are going to come and save you. Everybody should play a role in this important part of our lives.
General Lackman, AIP Public Policy Institute. And
you, Michelle, to tell us just a little bit about your career. So I found it very interesting that you've worked both in the non-disability field and also with the mayor's office. I think it would just be interesting to hear a little bit about how you did both those things and how you came to compete to be Ms. Wheelchair Texas and Ms. Wheelchair America.
Sure. I could say that I didn't start out, deciding that I was going to be a disability advocate. I was born with spina bifida and spent a lot of my life feeling like I was being separated from my peers, shall we say, treated like I wasn't normal or a part of the class in the same way that my other peers were. And so, consequently, I, for a long time, felt, spent my life just fighting just to, hey, show everybody that I could do anything that anybody else could do and that I was normal. And I also had kind of one of those personalities that I was kind of a bit of a, risk taker, or, I climbed trees and did all kinds of crazy things, which I won't, I have some stories, but, which like to ask you to tell. Well, maybe I will in a moment, but getting back to Brewster's question, I decided to, let's see, I majored in psychology in college, and from there decided to go into public health and health promotion, and I felt like that was just kind of very fitting with my personality. And as I got into public health and started studying it, I really began realizing, hey, what about me? How do people with disabilities, how are they being considered in public health? And the answer is very minimally, and people with disabilities are very vulnerable in a lot of ways to a lot of health problems, to developing obesity, diabetes, secondary health conditions that may or may not be related to their disability. And I was at the same time realizing that I had my own condition that was on top of my existing disability, and I became very nervous and scared that was going to interfere with my independence down the road. And you may be getting the idea that independence is something that I feel pretty strongly about. So I did a lot of research on my own, because that's what I did. I went into the research field. I've been in the research field for quite a while. So I put my research skills to work, and I found the Center for Research on Women with Disabilities at Baylor College of Medicine, and knocked on their door and said, hey, hire me. And they did. And which I was very fortunate for. Dr. Peg Nosek is the executive director of that organization. She's a wonderful, fantastic lady and my mentor. And through her, and she's also used to be very active, and still is, I should say, in disability civil rights. I started to find my voice through her mentorship. And decided to volunteer in a lot of different ways on disability issues, and the mayor appointed me to the Houston Commission on Disabilities, which is a 12-member commission, 9 out of 12